Hello everyone, welcome back to my channel today. I am Chioma Leo and I'm here to talk on a very important topic, and that is non-adherence to prescriptions or non-adherence to prescribed medications. Yes. Have you ever been sick before and you went to the hospital and the doctor prescribed some drugs to you? And you got home, you took it 1 day, 2 day, and you started 2 days and you started feeling better. Then all of a sudden you stopped taking the medication. Yes, most of us have found ourselves in this kind of situation and it is not new. But I want to shock you. Do you know that that practice of stopping your medication before the time the doctor said you should use them is very, very risky and dangerous, especially for the antibiotics. Most of the times we come down with infections that are caused by bacteria, and the doctor prescribes an antibiotic for you or antibiotics for you, and you get home, you take it 1 day, 2 days, 3 days, and you stop. And you are supposed to take it for up to 5 days or 7 days. When you do this, what happens is this. It's just like you see the antibiotics as a Pac-Man now. Yes, it's gobbling up bad bacteria, and all of a sudden you stop taking that antibiotics. What happens is that some of these bacteria will survive. They will mutate and grow and become stronger than they were before, and that is what we call antibiotic resistance. That is when it becomes so hard for the doctor to treat you again because you stopped the medication halfway. So it's just like when you are shooting, the antibiotics is like a gun now. You're shooting at the microorganisms, the bacteria, and you are shooting at it, and all of a sudden the rifle or maybe the bullets got exhausted. When you still have much bacteria coming, so when it gets exhausted, what happens? These bacteria will now gain the grounds and they will start working badly for your system. So antibiotic resistance has been a major challenge in our society and even in the world today. And that has caused a lot of problem to individuals, making infections hard to be treated. So we need to make sure we stick and adhere to prescriptions by the medical doctors if we want to live in good health. Now, I'll be giving you some consequences of non-adherence to prescribed medication. The first one is lingering infection. It means you will continue to feel unwell for a long time. You will feel unwell for a long time. And it may even come to the point that you will have to be admitted in the hospital for you to get well, because the doctors will be looking for several means to make sure you get well. Then another thing is worse infection. The infection could be worse because you didn't complete the course of treatment. It becomes worse and you may stay in the hospital for a longer time, and doctor may have to use a higher version of an antibiotics to treat you, which will be more expensive. So financially, it would affect you. Then another thing is antibiotic resistance, which I explained earlier. When you are unable to finish your antibiotic medication, and the bacteria that have survived or that were not tackled by the antibiotics become stronger than before. They mutate and they grow stronger and they attack your system harder. It makes the infection to be worse and makes the treatment to be hard for the doctors. So you need to avoid antibiotic resistance by adhering to your prescription. If they tell you to use this particular antibiotics for 4 days or for 10 days or for 3 days, 5 days, make sure you stick to it and follow the doses so that you will get well very soon and also get your health back. Then another thing, beyond antibiotics, sticking to all medications matters a lot. Whether you are taking your antihypertensives or you're taking your okay, let's say diabetic drugs, sticking to these medications are very important. Is very important rather. You need to adhere to whatever the doctor said you should do for you to get back to your feet on time. Then generally, if you are not adhering to the prescribed drugs, it could reduce the effectiveness of that medication. The efficacy will be in doubt because you are not following the regimen. Maybe they told you to use this drug 3 times a day. You have to use it 8 hourly. That is 3 times a day. And you are using it only 2 times. The drug's effectiveness would be tampered on. It will not be as effective or efficacious as it's supposed to be. And it can affect your getting well. It will make it longer for you to get well. Then another thing is that not adhering to your medication, whether antibiotic or other medications, it could lead to complication. Yes, because the problem or the sickness or the disease is not getting enough treatment for it to give way. So it makes the situation to be complicated. You could develop some other major issues in your health, and it will be very bad and deadly. Now, there are some tips I would give you to help you to stay in check and also to make sure you obey prescriptions. You can actually use alarms. There are some apps, medical apps that helps you to remind you when you're supposed to have a medication. You can actually download them or you use your alarm on your phone and set time to take your medications regularly. Then also you need to talk to your doctor because sometimes some people say, anytime I take this medication, it makes me vomit or it makes me feel nauseated. It makes me feel this. If you are uncomfortable with any side effect of a drug, it's best you go to the hospital and let your doctor know about it. And he may also change the medication to another one that will also serve the same purpose for you. So you need to do that. Set alarms. Set alarms is very important. Do not stop your medications halfway. It is very deadly and very bad for your health. Thank you so much. This is where I'm going to be stopping today. I just decided to make sure I remind you about the importance of adherence to medical prescriptions. Thank you till we meet again. Please click on the subscribe button and share this video. You might be helping somebody. Thank you. Bye. See you next time.